You ever wonder how a simple, everyday fall can cause a really serious injury in an older person? Well, today we're going to take a deep dive right down to the cellular level to understand osteoporosis. It's a disease that quietly weakens our skeleton, and we're going to start with a story that shows just how suddenly this silent disease can make itself heard. So, our story doesn't start in a high-tech lab or a hospital. It starts at home, where a totally normal day takes a very sharp, painful turn. This is where the quiet problem of osteoporosis becomes frighteningly loud. Okay, so picture this. A 68-year-old woman just going about her day. Doing chores she's done a million times. She catches her foot on a rug. Just a simple slip. For most of us, that's nothing. Maybe a little stumble and you catch yourself. But not for her. The result is a severe wrist fracture. And that gets us to the big question we're tackling here. Why? How does a common, low-impact fall cause such a major break? The answer, it turns out, is hidden deep inside the microscopic world of her bones. To really get what went wrong for her, we first have to understand what goes right in healthy bone. See, your skeleton isn't just a static frame like the studs in a house. No way. It's a living, dynamic tissue that's constantly rebuilding itself. It's this incredible, perfectly tuned balancing act. This whole process is called bone remodeling. Think of it like a highway crew that's always on the job. Your body is constantly breaking down old, worn-out bits of bone and laying down fresh, strong, new bone in its place. It's what keeps your skeleton strong and ready to handle whatever you throw at it. And this whole operation is run by two main teams of cells. You can think of them as a construction crew and a demolition crew. So on one side, you've got the osteoblasts. They're the builders, the construction crew, laying down all the new bone. And on the other side, you have the osteoclasts. That's the demolition crew. Their job is to clear out the old, damaged bone. And in a healthy person, these two crews work in perfect sync. But in osteoporosis, that delicate balance is completely thrown off. The demolition crew, the osteoclasts, they just go into overdrive. They start tearing down bone way faster than the construction crew, the osteoblasts, can possibly rebuild it. Demolition starts to win. And this slide right here shows you exactly what that looks like. I mean, look at the difference. On the left, that's healthy bone. See how dense and interconnected it is? It's like a strong sponge. But on the right, that's osteoporotic bone. It's full of huge gaps. It's become porous, brittle, and just incredibly fragile. Now, there are a bunch of things that can tip the scales and cause this imbalance. Age is a big one. Our builder cells just get a little slower as we get older. Being female is another huge factor, especially after menopause. That's because the hormone estrogen naturally keeps the demolition crew in check. When estrogen levels drop, it's like taking the brakes off the osteoclasts and they just go to town. And of course, things like your genetics, your diet, certain meds, and lifestyle choices all play a part in this cellular tug-of-war. Okay, so we have this problem happening at the microscopic level. How does that actually show up in a person? And more importantly, how do you even find a disease that is so good at hiding? This is the really insidious part. Osteoporosis is called a silent disease for a reason. It doesn't hurt while it's developing. There's no pain, no warning signs. The bone loss just happens, quietly, for years. And often the very first symptom is the snap of a bone, just like in the story we started with. Over time, though, some visible clues can start to show up. Someone might notice they're actually getting shorter. What's happening is they're getting tiny, often painless fractures in the vertebrae of their spine, causing them to compress. This leads to that stooped posture we call kyphosis. And in really severe cases, that curve can actually start to compress the chest cavity and reduce lung capacity. It's a great example of how a skeletal problem can end up affecting the respiratory system. So if it's so silent, how do we possibly diagnose it before a fracture happens? Well, a lot of the time it comes down to this one very important number, -2.5. This number is called a T-score, and you get it from a special kind of X-ray called a DEXA scan. All the T-score does is it compares your bone density to the average bone density of a healthy 30-year-old. So if your score is -2.5 or lower, it means your bones are significantly less dense than they should be, and that is the gold standard for an osteoporosis diagnosis. All right, so we get the problem, and we know how to find it. Now let's talk about solutions. How do we fight back? Well, the goal of treatment isn't just to deal with the symptoms. It's to go right back to the source, to intervene at that cellular level and get that balancing act between demolition and construction back on track. The strategy is really a three-pronged attack. First, we've got to slow down that demolition crew that's working overtime. Second, we want to give the construction crew a major boost. And third, we have to make sure both crews have all the raw materials and the support they need to do their jobs right.
And this is where modern medicine gets really cool. We have drugs that can target these cells with incredible precision. So medications like bisphosphonates, they basically tell the osteoclasts, the demolition crew, to take a break. Other drugs, like denosumab, actually stop new demolition workers from even being trained, preventing young osteoclasts from developing. And then you have drugs that do the opposite, like PTH analogs. They go straight to the osteoblasts, our construction crew, and tell them to get to work building new bone.
But it's not all about medication. Lifestyle is absolutely fundamental. Things like weight-bearing exercise, walking, jogging, lifting weights, that puts physical stress on your skeleton, which is a powerful signal to those builder cells to get stronger. And of course, you need the right building materials. A diet with plenty of calcium and vitamin D is non-negotiable for healthy bones.
Okay, let's step back and pull all of this together. We're going to look at the whole story, from a perfectly healthy bone all the way to effective treatment. So, here's the sequence in a nutshell. We start in a healthy state with that perfect balance in bone remodeling. Then something goes wrong. The osteoclasts take over, resorption outpaces formation, and bone becomes weak. That leads to the clinical signs: fractures, losing height. We diagnose it with that T-score of -2.5 or less, and finally, our treatments are designed to go right back to the root of the problem and fix that cellular imbalance. And all of this leaves us with one final big picture question. We understand the cells involved. We get the mechanics of this disease in amazing detail. So the real challenge for the future is this: how do we take all that knowledge and come up with even better ways to prevent this disease, to stop it dead in its tracks, long before that first silent fracture ever gets a chance to happen?